Welcome to Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. This is a place where we discuss important health-relating issues that matters to the mother, the father, the child, the family, the community at large. My name is Amazing Rita, and with me in the studio is Dr. Dimba Favor. Hi, Dr. Favor.
Hello, Rita.
This is going to be an interesting episode.
I'm hopeful as
Yes, I know it's going to be so interesting.
Yeah.
Well, we'll be talking about understanding birth defect. Have you ever seen a child that was born with a defect or something that is not normal? Let me put it that way. Maybe the lips, the hand, the leg, or the spinal cord, anywhere, but you just see that that thing is not as it should be. And then you notice that the mother or the father, there's always, it starts with the nurses.
Okay.
When the nurse delivers it,
So start whispering among themselves.
something. Once the whispering starts,
you know that something is
something is
here.
wrong.
Exactly.
Thanks to, I've not given birth before, but thanks to Nollywood and Hollywood. So, and then the mother is so concerned, the father is concerned, you know, they are thinking, how would the development of the child be? Will this hinder the child from living a normal life?
Yeah.
Will it get better? Can it be corrected? So many questions. Okay. And apart from that, you know, questions concerning the child, there's a question of, am I the cause? Was it something I took? Was it something I did? So we're going to be discussing all about that in today's episode. So let's get right to it. Dr. Favor, what is birth defect?
So birth defects are abnormalities either in structure, function, in fact, even if it's a physical abnormality that is present at birth. So people refer to them as, you can call them congenital anomalies. Congenital means present at birth. That means when this child is born, this defect is present. So it could either be physical, it could be functional, it could be structural abnormality in a child present at birth. Yes.
So, you know, is there any point where you say at maybe 2 months, 3 months, or 4 months in pregnancy that a child starts having or developing birth? I don't know how to say it. I won't say develop now, or the child starts being
like
defect.
Where this defect can start occurring.
Yes, where the defect starts occurring.
Yes, but it depends actually. Like majority of times in the first trimester.
Oh.
Because in the first trimester is when organogenesis takes place.
Okay.
Organogenesis, just like in the Bible, Genesis is like beginning.
Okay.
Organ. So the formation of organs, what we call organogenesis. So it usually takes place in the first trimester. But majorly, some vital organs are formed in the first 28 days.
Okay. So you mean the first 28 days?
The first 28 days are very vital days, but it's not fixed. It's not like it's a fixed number. But this first 28 days, that's where some organs are formed, especially the heart. Okay. Exactly.
Okay.
The spine, the neural tube also forms in the first 28 days. Yes.
Okay. Now, I talked about the hand, the leg, the spinal cord, you know, the mouth, ear, or whatever. Are there some internal birth defects?
Yes, there are internal birth defects, like there's something they call a diaphragmatic hernia. There's a part of the body called the diaphragm. This diaphragm has a function of separating the organs in the chest from the organs in the abdomen. Okay. Exactly. So this hernia is just like a space, an opening. So diaphragmatic hernia, that's already an abnormality because abdominal organs tend to push out through that opening into this area. Do you understand? So normally it should be closed. Okay. So I'm just giving it as an example. There are some defects that occur internally. Some defects in the heart as well. You can't see those ones. They are not. You will look at the child and you will know this child has a defect in the heart. Exactly. So That's like a septal defect. That's what people usually refer to as hole in the heart. Septum is like what divides the heart. Exactly. So there's a space in between the septum. So that's what people usually refer to as a hole in the heart. So for defects like that, you can't see them when you just look at the child.
Okay. What about, you know, there was a time we were talking about kidney failure. And you said some people are born with one kidney.
Yes.
So can you call that a birth defect?
Yes, it's a defect actually, because normally you should have like two kidneys, but this person is coming to life with just one.
So are all birth defects visible at birth? Or are there some that as the child grows, you just notice it?
Not all are visible at birth.
Okay.
But most are visible at birth. Okay, like there are some defects now. Let me give an example with this hole in the heart. If the hole is very little, very small, the child may grow and then grow out of it. Do you understand? Like it may close up with time.
Okay.
Exactly. And this child will live normally. No one will even notice that this child has any defect. So there are some that with time, they now start manifesting. Some, the child outgrows it. The child will never have any effect from that defect. And some, the child is born and then you can see them.
Oh, wow. All right. So I heard that some birth defects can be diagnosed while the woman is still pregnant.
Yes.
Okay, so I know, or should I say I know of some. Can all of them be diagnosed while the woman is still pregnant?
No, not all. Okay. Just like you said, some. Not all birth defects can be diagnosed in utero, but most can be diagnosed in utero. Like I said, some babies come to the world and then they grow and then they live their lives without even you knowing that this child has a defect. Do you understand? And some come with these defects and every now and then they're in the hospital having one challenge or the other from this defect. So most can be diagnosed in utero, but not all.
Okay. But there are some cases where they would maybe do a scan or something and then they'll notice that the child has this or this, like a defect.
Yeah.
But I've heard some mothers say when they give birth to the child, like the defect is no longer there. What happens?
Anyway, I think it's a possibility. And I can say what happens here is this. In utero, possibly they just did screening tests.
Okay.
Screening tests, like they are just trying to tell you, they are not definitive investigations. Do you understand? Exactly. They don't, how do I explain it now? They don't tell you that this child has this. They just suggest to you that it's likely that this child will come have out with this. Exactly. So that could be a case scenario where maybe the mother went for some screening tests and then they told the mother it's possible that this child will have this or this. And then the woman is giving birth to that child without any of those. Yes.
Okay. All right. There's something that's coming to my head, like when they are giving the testimony in the church, and they say the doctor said.
Yes.
So sometimes it's not okay. So it's not like the doctor said. It's what the doctor saw and then predicted that this might happen. Okay. So let's talk about causes of birth defects.
There are various causes of birth defects. It could be environmental causes, like what the mother, the maternal factor, what she's exposed to. In the environment, there could be toxins she's exposed to, which will further affect the child in utero. Then diet. Some women while pregnant, they take a lot of alcohol. They take a lot of alcohol, they smoke. Exactly. So this could cause birth defects. Another cause of it is non-adherence to antenatal visits and non-compliance to routine medications, especially the folic acid.
Okay.
I don't know if you've seen children, babies, when they are born, they come out with a defect on their spine. Like you see towards the end. Exactly.
Like a fluid or something.
Beautiful. So that's what we call spinal bifida. and usually is caused from insufficient folic acid.
Oh.
Yes. So folic acid is one of the routine medications necessary to take during pregnancy. Very, very important. But when a pregnant woman is not compliant with the medications, she could be at risk of giving birth to a child with birth defect. We also have things like exposure to radiations. All these people, we know what radiations do. They affect the DNA. Exactly, they affect the DNA. So DNA is like the building block of so. When this DNA is affected, it could lead to a birth defect in the child. We also have things like trauma. Imagine trauma usually causes the type of birth defect called the structural. Like this baby will come out with structural abnormalities. Something like, I don't know if you've seen babies, they give birth to with their legs like this, club foot. They call it club foot. I don't know if you've seen it. Exactly. Feet. Beautiful. Yes. Their feet, sorry, not their leg. It's like this. That one can result from a trauma. Yes, because when this woman, imagine a woman now pregnant, she has a trauma, maybe she has a fall or an accident, and then it causes oligohydramnios. Oligohydramnios is, let me use the layman's term. You know where women say, my water has broken. And that fluid there, it has a very vital role for the fetus. It tries to cushion, it serves as a cushion against external forces. That's one of the roles. So imagine a case where maybe she has an accident or just a trauma, and then that fluid reduces. Yes, this child would have structural abnormalities. Yes, other things like maternal chronic diseases, like mothers who are diabetics, like long-term diabetics, their babies are at risk of congenital cardiac defect, that's heart defect. So these are some of the causes of birth defects.
Is there a real infection during pregnancy causes?
Yes. Poorly treated infections, or there are some of them that could be treated, while some, when the woman is planning to take in, she should be vaccinated against them. But then when something like rubella now, there's something they call congenital rubella syndrome. Yes. If a woman has the rubella virus and then she's not vaccinated against it or not treated, and then she takes in, this child could come down with that syndrome. And the syndrome comprises of many things: deafness, blindness, even cardiac issues. So poorly treated infections also have a role to play in birth defects.
Now you said, I don't know if you mentioned it, like poor diet.
Poor diet also very important. The reason is this: first of all, when this woman is not feeding well, she would lack some vitamins, some vital nutrients, exactly, especially folate, that's folic acid, vitamin B12, and these things, they play a role
in the baby's development.
Exactly, they play a role in the baby's development and even in the mother. Yes, because it will help her red blood cell development. But in a case where she's deficient in these things, you would see that the baby will come out having low iron stores. So diet is also very important in pregnancy.
Brings me to the question I want to ask you.
What's the question?
Poor diet. Now, there are some women that will give birth to children, and probably they'll have defect because of poor diet. But is there a medical explanation to people who are mentally ill, women who are mentally ill that are pregnant and they give birth to healthy babies?
Mentally ill?
Like pregnant mad women that are pregnant. But when you give birth to the child, you see that the child is sound.
I think I can explain this scenario now. Let me put it this way. This woman is mentally unstable. She takes in, but she gives birth to a sound baby. It's possible she's eating very well. Remember I said, yes, it could be a possibility. Remember I said folic acid is a very, very vital is a very vital vitamin needed in pregnancy. So you could equally get folate from your diet.
Okay.
Imagine this woman in her unstable state. She goes round, she eats
And
a lot
people are
of
giving
things.
her
People
food
exactly
because she's pregnant and the rest.
So the fact that she's pregnant, the fact that she's mentally unstable, like people just give her things and then she eats. She's not selective of what she's eating.
Yes.
She just tries to eat everything. Do you understand? And then this woman in her unstable state, she's not exposed to radiation. I won't say she maybe, okay, some could be taking alcohol. For those ones, the children may have 1 or 2 defects.
Okay.
But imagine one who is not engaging in alcoholism, she's not exposed to radiation because she's obviously mentally unstable. She's feeding well. So I think you can explain it to an extent.
Then we that eat some women that eat 3 square or 3 triangle meal. What is it? That's a topic for another time.
No problem, it's
Okay.
fine.
So tell me how birth defects, how are they detected?
Okay. So birth defects can be detected in several ways.
Okay.
Yes. Okay, let me start by saying we could do some imaging.
Okay.
Some investigations like the fetal MRI. This fetal MRI, you want to just see the baby inside, check the organs, just check the baby generally. You can also do scans. Scans can help you detect some abnormalities, not all, especially between the 18th to the 22nd week of pregnancy.
Okay.
Exactly. Scans can help you pick some, not all.
Okay.
Then we also have something like chorionic villi sampling. Like they'll take the fluid and then test it, because there are some birth defects like Down syndrome now. In Down syndrome, the patient will have reduced alpha fetoprotein. So when you take this fluid, you want to test it for some of these things. So these are some ways to detect if a child will come out with birth defects or not. Yes.
Okay. All right. So what is the difference between prenatal screening and diagnosis?
Okay, prenatal screening is just like the name prenatal, before the child is born.
Okay.
Yes. You're just like I said earlier, screening, this screening is not telling you that this child has this thing in particular. It's just giving you an idea. This child may have this or may not have it. But after the screening, the diagnostic investigation is now the one that will confirm if this child has this or not.
Okay.
So I think that's a difference, because the screening, the prenatal screening, just tells you it's very possible this child will have this or this, while the diagnostic will tell you this child has this. Okay. Another difference I think is this. For the screening, the prenatal screening, that one is less invasive, because you're just trying to say we have to keep in view this or this. But then for that diagnostic, you want to collect samples to test it, to actually tell you this baby has this. So because you're actually collecting, like it's more like you're invading. So it poses the mother and the child to more risk of infections, while the prenatal screening is a bit safer. So these are some differences.
All right. At what point of the pregnancy is ultrasound very important? I mean, to check for defects.
For defects, usually between 18 weeks to 22 weeks. Yes, in the space of 18 to 22 weeks. Ultrasound can pick up some, but not all birth defects. Okay.
Now, let's move to another part. Tell us some of the common birth defects you've seen or they are in children.
Okay. Just like you said, common. Many people, a lot of people, I'm sure, would have seen the cleft lip and cleft palate, where you can see a demarcation in the lips of the child. Many people, for instance, what we discussed when we started this session, some babies, they have the spinal bifida We also have anencephaly. Anencephaly is a situation where the child does not have all or part of the head.
Oh.
Yes. And some others, we have club foot.
Yes.
That one is very, very common in a lot of babies because it can easily be corrected.
Okay.
So some others, like we discussed earlier, some cannot be seen physically. Some are like they are inside. Exactly, just like the diaphragmatic hernia I explained earlier, the congenital heart defect. Congenital heart defect is like a broad term. It comprises different things. This person could have ventricular septal defects. That's like the septum. I told you septum is what separates. The septum separating the ventricle, the left and right. There could be a hole in it.
Yes.
They could also have atrial septal defects. That's the septum separating the atrium. There could be a hole. So these are examples of some anomalies.
Okay. Do all birth defects require surgery to correct it?
Not all birth defects require surgery. Some require surgery, but not all. Yes. For example, now, even the ones requiring surgery, it must not be just the ones you can see phenotypically, like when you look at the child.
Yes.
There are some inside that will also require surgery, like some heart issues, that septal defect now, some of them will require closure, surgery. The diaphragmatic hernia will also require surgery, but not all.
Not all.
There are some that don't require surgery.
Okay. Now, can a baby with birth defects end up living the life normal?
Yes, very possible. Very, very possible. For example, now let me give a scenario. Imagine a child being born with omphalocele or gastroschisis. You see some babies when they are born, you see like their intestines. I just want to paint a layman's picture that everyone can easily understand. You see like their intestines are outside. The contents, the abdominal contents are outside. Exactly. So when a surgery is done and then the defect is repaired, this child will live a very normal life.
Okay.
Yes. So it's very possible for babies with birth defects to live normal lives, provided that those birth defects are attended to, corrected, or treated.
Okay. What step can women take during pregnancy that can help reduce birth defect? Yeah, the risk of the child having birth defects.
First of all, they should be adherent to the antenatal visit.
Okay.
In fact, before adherence, they must first book for antenatal. That's the first step. Because some people just feel like, I don't think it's necessary, or they wait till late into the pregnancy before they go to book for antenatal pregnancy, for antenatal care visit. So the moment a woman discovers she's pregnant, she should book for antenatal visit.
Okay.
Secondly, being compliant with her medications. Like I said, folic acid is very, very, very important. Eating healthy. Remember I said some of our diets help with folic acid, vitamin B12. These vitamins are very important. Regular exercising. Then mothers that have chronic diseases like hypertension, diabetes, they should make sure they are compliant with their medications. Then in pregnancy, it's not any medication you see, you just feel like, I used to take this medication before I was pregnant, let me just take it. No, some medications are teratogenic. That is, they affect the fetus. They are not good at all. So that's part of the reasons why it's important they go for their antenatal visit. Then also exercising regularly. I think it has a role to play. It just helps them stay healthy, maintain a healthy weight. Because remember I said diabetic mothers, their babies are usually at risk of congenital heart defects.
Okay.
Yes. Then also, like I said, avoiding some medications. Some people even feel like, okay, I'm not taking the medication per oral, I'm not taking it in my mouth, I'm rubbing it on my skin. But it also affects like now, this tretinoin, it's highly teratogenic, very, very, very teratogenic. Some people have family history of congenital anomalies, birth defects. So people like that, before they conceive, before they take in, they should go for what is called pre-conception care.
Okay.
So the doctor or the healthcare provider will guide them on things to do before taking in. Then people who have some infections that would need to be vaccinated, they should ensure they take these vaccines before pregnancy or in pregnancy, just as guided by the healthcare physician.
Okay.
So these are some ways this can be curbed.
All right. So I've always heard of women treating malaria during pregnancy.
Okay.
Is there a way untreated malaria can cause birth defects?
Exactly. Yes. Untreated malaria can cause birth defects. Untreated malaria can even cause miscarriage. Yes, it can be that bad. It can cause the woman to miscarry the baby. Yes, so untreated malaria can have effects as well on the baby. And even the treatment for the malaria can equally affect the baby. That's why I said a pregnant woman should not just take any medication because she feels like this, maybe I used to use this medication before I was pregnant. Even the treatment of the malaria can affect the baby if you don't treat it well or use the right medications.
2 more questions before we leave.
Okay.
Firstly, why is it important to check for birth defect while still pregnant?
The reason why it's important is this. If there are some birth defects that are very bad.
Okay.
So in utero, maybe the physician has noticed that this baby is having this birth defect, and if the baby eventually comes out with this defect, it will not even be good for you or for the baby.
Okay.
So they would give you an open choice.
Okay.
Based on the physician's, how do I put it now, counseling.
Yes.
He may give you the option of terminate this pregnancy because this child will come out and suffer. You, the mother, will equally suffer.
It's probably very bad.
Terrible. So he may give you the option, but he's the physician. His work, he or she just counsels, and then you're left to decide. Exactly. So I think that's an important reason why
detecting it early.
Exactly. Detecting it early is important, because if it's that bad, you'll be left with making a choice. I think it's good I take this out so that this baby will not come to the world and keep suffering, including me, the mom, suffering. So that's one of the reasons it's very important.
Okay, so what's your word of advice to women or mothers who their children have one birth defect or another? They're struggling to cope with life with the child. The child needs extra care right now. Child needs extra care. They have to be there for them. They have to, shower more attention on that particular child. So what's your word of encouragement, advice, and everything? Okay,
most times it's not even easy to have a child with a defect. It's very, very draining, both to the child and to the family, the mom, the father, especially if the father is a supportive spouse, not if he's unsupportive or he doesn't care. Yes. So my word of advice to them, to mothers or parents who have children with defects, is this: it's not a death sentence, and these children can equally do well. So I know it's very draining, it's very taxing to give them your all, but then just be encouraged, because they can still be their best in their own way. There are many children with defects that are still doing wonderfully well, doing wonders. If you look them up online, you see a lot of them. So you could even draw inspiration or get encouraged from them. You could as well, in subsequent pregnancies, just like now there's a child with a defect, in subsequent pregnancies, before she takes in, she should see a healthcare provider for the pre-conception care, so that they direct her on things to do. Then thirdly, I will add that the child is also a star. Every child is a blessing. So irrespective of the anomalies, the defects this child is having, never put bad words. Never speak
Yes,
bad
to
words
the
into
child.
this child.
Yes.
Keep encouraging the child. And at the end, you'll be pleased and happy that you did it.
Thank you so much.
You're welcome.
Thank you so much for sticking with us on this episode of Health Unplugged. We talked about birth defect, what causes it, how the mother can actually help and detect this on time to prevent, or if it's something that I've even heard of some surgeon or doctors perform a surgery in a child that's already they'll bring out the child, do the surgery and put the child back.
Yeah.
And the child will grow healthy.
Well.
So it's better you detect it early so that early measures can be taken to correct whatever it is. Or even if you cannot treat it then and you're waiting for, but you have this in mind that the child may come out with this, and then you prepare yourself, your mind, your family, and everything on how to cope and adjust to the child coming out with that burden. But we don't pray for that. But for those who their children is already having a defect or another, the child is not less of any child. It's just how it is right now. Exactly. So you can actually help your child to become the best. You know, there was a video I saw in children, like when you're talking about children, they don't see the defect. It is we that see it, and they'll be like, it's when they now grow up, they're not noticing that I'm different from this person, I'm different. So till maybe when they have that mindset, help them be the best they can be and help them adjust to their world properly. And then again, we social media users, when there's a way they would,
throwing tantrums. Like whenever
shaming the child, a mother would be so afraid to post the child, and when she posts that child, you
slam the child.
There's a celebrity child that, oh my, and you see the comment section is, and how can you be trolling a child? A child,
not an adult.
A child. We can do better. We can do better, because when you're doing that, imagine, I'm not saying it's going to be you, but imagine it's someone you know, or it's you.
Or even you.
You yourself. How would you feel when anytime if someone posts their child and then you're trolling them? Please, let's do better on that. And don't forget, as a pregnant person, or you're trying to get pregnant, or you're intending to get pregnant one day or another, there are things you should see as gynecologists. Like a doctor told me that it's not when you want to get pregnant, you start preparing for pregnancy. Before taking in, so that you can actually help to avoid whatever, any defect or another. Thank you so much for staying with us till we come your way again. Don't forget to like, share, and subscribe. And if you have any question, drop it in the comment section, and we'll be happy to answer your question. My name is Amazing Rita.
I'm Dr. Linda.
And we'll see you again next time. It's bye for now.
Bye.